Our current guidelines tell us that we should test for EGFR mutations, ALK and ROS1 translocations, as well as PD-L1 in newly diagnosed patients. I believe that there are several other things that we know are potential oncogenic drivers, one of which is the BRAF V600E mutation. So in my practice, at the time of diagnosis, I tend to do more testing beyond EGFR, ALK, and ROS1, because I do think that we have evidence now that, specifically in the BRAF population, that the use of targeted therapies to the BRAF mutation is associated with much higher response rates than we typically see with chemotherapy. Now, what we don't know yet is the impact on progression-free survival as well as overall survival, but studies are currently ongoing to help characterize that. The population of patients that have BRAF V600E, and there is some heterogeneity in the nature of BRAF mutations. So I think you have to be specific and realize that we're talking about the V600E mutation, which is actually the same mutation that the melanoma patients have, quite similar. Many of the oncogenic drivers like EGFR, ALK, and ROS1 are typically seen in never smokers or former light smokers. The BRAF mutations may be seen in never smokers, but are also commonly seen in smokers. There doesn't seem to be any sex predilection. They can be seen in men and they can be seen in women. Getting back to the V600E versus non-V600E BRAF mutations, it's about maybe 50 to 70%. There are a number of series that have looked at this. One of the problems with interpreting the series is that some of the series kind of are heavily weighted with surgical patients, so early stage patients. Some of them are heavily weighted with stage 4 patients, like our patient here. We actually looked at this from the original Lung Cancer Mutation Consortium study, which was all stage 4 patients. The BRAF V600E mutations were, about 70% of the BRAF mutations were V600E versus non-V600E in that study. Others have suggested it's about a 50-50 distribution. So I still think we're learning a little bit about this, but I think the importance is to understand that we're really looking for the V600E mutation in this setting. And again, these patients, you could call them typical lung cancer patients. They aren't like the EGFR mutant patients that are typically female, never smokers, Asian adenocarcinoma patients. These patients are principally adenocarcinoma, but they can be seen in smokers, they can be seen in non-smokers, they can be men, women, it's a very kind of average sort of lung cancer population. Again, current guidelines kind of really call out testing for 3 molecular alterations, EGFR, ALK, and ROS1. Over the past couple of years, there's been clear evidence that BRAF mutations, that MET alterations, either highly amplified patients or patients who have exon 14 skip mutations, patients who have RET alterations or HER2 mutations. There have been clear responses associated with targeted agents directed at those molecular alterations. So I think in the first line setting, I'm actually interested in going beyond the big 3 to things like BRAF and RET and MET and these sorts of things. Because right now we have targeted agents that may help these patients. And unless you multiplex or do more, you aren't going to find these alterations. My personal belief is there are probably only about 7 or 8 things that I've mentioned in the first line setting that would make a real difference to me. You can multiplex and do several hundred genes, and sometimes you find some things that may be helpful to the patient, but going beyond where we have data, you could characterize it as a bit of a fishing expedition. Sometimes you find things that aren't meaningful, or you find things in which We don't have drugs that target these alterations, or we find things in which we don't know if the drugs that might target them are going to work. So it's relatively controversial what you go, but I think there are 7 or 8 things that if a family member of mine were diagnosed with lung cancer, I would want my oncologist to know that. And one of them is BRAF V600E mutations, because we have targeted agents that are effective in these patients.